Hi, I am Gina Ruiz, and I am a student at the University of Texas at Arlington MSN Nursing Program. For today's assignment, I will be demonstrating a manual measurement of blood pressure. I have washed my hands and I'm going to put on my gloves. I have introduced myself to my patient, and I have been granted permission from this patient to take her blood pressure. I have assessed her arms, and she has no restrictions on either arm to do the blood pressure. My targeted audience for today's demonstration are for two newly hired nurses at the Valley Baptist Hospital Medical Surgical Floor called 3 Tower. My outcomes for this presentation will be to properly use the stethoscope and also to properly learn how to measure manually the blood pressure. First, we're going to go ahead and place the blood pressure cuff on. My teaching strategy is going to be a form of a demonstration. This particular cuff comes with arrows to guide you where the placement of the brachial artery would be on either on the right or the left. And also with this particular cuff, it comes with its own stethoscope, and the diaphragm is already included in the proper placement of it. Some nurses may not like that, and they may prefer to use their own stethoscope. It's to the nurse's preference. Today we're going to use the diaphragm that was provided. I'm going to palpate till I can no longer hear the brachial artery. Once I know I'm at that point, I'm going to slowly release the sphygmometer and listen. I'm listening for a top sound and a bottom sound. And right now, her blood pressure was 120/80. You have perfect blood pressure. That is a very healthy and very realistic blood pressure. One of the priorities in nursing at any level is patient safety, and knowing how to manually properly take the blood pressure is vital. There's a lot of times where we don't have our monitors because we don't have electricity, and sometimes the monitors will give us an inaccurate reading. And to manually check it, it gives us a better accuracy because you're basically hearing what the vessels are telling you, and you can more assess your patient because you're one-on-one right there with yours. Our nurses here during the orientation process, they have the opportunity to get skills in a skills lab. They have time to practice before they're on the floor. They also are educated academically with book knowledge. They go through a orientation process before they're allowed to be on the floor, and they are still monitored with a preceptor once they're on the floor. Our nurses are taught to utilize PRN medications, and it's very important to know how to assess the proper blood pressure after a PRN IV medication is given. And they're learning a lot, and a lot of our nurses are LVNs that are coming from nursing homes to a medical surgical floor, and that's a big difference in the work environment and the use of these medications. It's a different type of aspect, and patient safety is vital. So my teaching technique was a demonstration of the manual blood pressure. My targeted audiences were the recently new hired nurses for 3 Tower. And the outcomes were to know how to listen with their stethoscope, and to how to properly take a manual blood pressure. And it is all for the safety of our patients.